Philippa Whitt.
Thank you very much, Mr. Speaker. I welcome the plan. I have to say I would have welcomed receiving the briefing that the Shadow Secretary of State mentioned yesterday, which I did not receive. This does lay out a reasonable worst-case scenario and is very clear about the 3 timed phases because, of course, research is ongoing, and I think it helps prepare the public for decisions that may have to be made down the line. At the moment in containment, it is based on self-isolation of cases, contacts and those who have travelled to risk areas. But with the spread elsewhere in the world, it's becoming harder to define risk areas. With regards to North Italy, this Chief Medical Officer talked about those with underlying conditions, perhaps interpreting advice more stringently and not travelling. So will the government either discuss with insurance companies or even consider litigation so that having underlying conditions would be an acceptable reason to cancel a holiday and actually get the money back, rather than people putting themselves at risk? I would agree with regards asymptomatic workers and sick pay, but there are staff who have no sick pay in their contract. So there has to be some protection given to them. And while the Secretary of State referred to the 7 days self-certification, isolation is for 14 days. And we do not want people turning up at a GP surgery halfway through that period. So can that be looked at? One of the issues that I've come across is where an employer has told a member of staff that when they return from holiday in Tenerife, they should not come to work for 2 weeks, but the employer does not wish to pay them. So we need to look at that, even if it's not health advice, but an employer stipulation, but expecting people to have no income. Obviously, as we move into delay, we see that children are not particularly catching this, but as with other coronaviruses, they may well spread it. I wonder if we have evidence for how much they contribute to transmission, as that will affect decisions around school closures. And what preparations are being made for the long haul? If we look at previous corona outbreaks, they have not just been over a few months, they have often been over a year or so, and we could be dealing with this in next winter. If we move into mitigation, it reverses, and it's about protecting the vulnerable and early discharge to home care. This may require the changing of staff from hospitals and care homes to actually work in the community. So is the government in negotiations about things like legal responsibility and liability? And of course, the Secretary of State quite rightly talks about what the public should be doing. But should we be already thinking about stopping shaking hands? Should we already be thinking about working from home if we can, without an economic impact? This would help the climate emergency as well as this. But containment moves into delay without a border, so should we be thinking about trying to get ahead of the curve?
Hear, hear.
Thank you very much indeed. Mr. Speaker, we have been briefing colleagues as much as possible. Clearly the CMO's time is incredibly valuable at the moment, and we did sign off this plan and work with the Scottish Government with this plan, and this plan was signed off by both the First Minister for Scotland and the CMO for Scotland. So we've been, in fact, it is a plan that has been developed with the Scottish Government and with the Welsh Government and the Government of Northern Ireland. So it is ultimately a multi-party plan. She makes the point about 7-day certification. That is indeed the sort of reason that we're holding this area under review, and there's work ongoing, including on the points that she raises. She also raised the point about shaking hands. The medical advice on shaking hands is that the impact of shaking hands is negligible. What really matters is washing your hands. And so our public health advice will remain clear and based on that science, which is that what matters more than anything else is that people wash their hands for 20 seconds or more using soap and preferably hot water. That is the core of the public health advice. She also mentioned working from home. And there's an incredibly important point that is written into the plan, which is about timing. There are actions that we may need to take in the future that it is not appropriate to take now. So we are not advising people that they need to work from home now, but we don't rule out doing so in the future when that might be more effective clinically, given the disruption that it could cause.